This probably needs to be a little bit taller, right? So I'm going to eyeball it. Easiest way is just turn the silly thing over. I see students all the time trying to do this. Don't do that. Just turn the thing over. Put your foot on it if you want to hold it still. And I'm going to take it up as high as it'll go. You like pink? Good deal. Yeah, that takes like 10 seconds, right? Don't mess around with it. 16, maybe a little bit too tall for them. Who cares? Not that big of a deal. All right. So, good? Questions? So now we got to get to the standing position. So he's weight bearing as tolerated. Randy, you know, once we get standing up, you can put as much weight on that leg as you can. All right, it's up to you. All right, so now we have to do something. Randy's got to be able to stand up. In order for all of us to stand up, what do we normally do with our upper body? We lean forward, right? We put our center of gravity over our base of support. Here's his base of support. Now, Randy can't do this, right? Because he's got hip precautions. So what do we need to do? We need to have him extend his femur. Now, don't get confused. It doesn't matter what happens with the knee. What matters is what happens up here. Do me a favor, sit all the way back in the chair. Okay, now extend your leg. Good. So now we have a little bit of an increase in this femur. How much can he lean forward now before he exceeds his 90 degrees? We're looking at the angle. It's hard to tell because that's his wallet there. Here's about his ball of his femur. So he's at about an angle like this. How much can he lean forward? Tell me when he exceeds. About there. Okay. So now if Randy comes forward a little bit closer to the edge of the chair and extends his leg even more, now how much more can he lean forward? Good, right? So that's the whole purpose of extending the leg, is it opens up the angle of the femur to allow the patient to lean forward so he can get his base of, his center of gravity over his base of support. That's good. It's bad because it means he can only use one leg to stand up. When you put your leg out like this, you cannot use it. Biomechanically impossible to use it for support. So it's good because it allows him to lean forward. It's bad because it decreases his base of support. But that's the way to do it. The lower the surface it is, the more the patient needs to lean forward. So if Randy was sitting over here, he would have to go out even further so he could lean further even more. Does that make sense? It's a big, big thing to understand why the person extends their leg, simply so they can lean forward to get their base of support, center of gravity over the base of support. Good? All right. So now we've got him. He's in that position. Now he's really in what I would call an unsafe position because he's at the edge of the chair. He really doesn't have any side support. He's got one leg underneath him. The other thing is, make sure when you're doing this that this leg is back far enough. If Randy is like this, he cannot stand up. Physically, I can't stand up like this. I would really have to work hard. So this leg has to be up underneath him so that he can really use it to push himself up to support. Right? All right. So now you got two things to do. We can stand up with the walker one of two ways. I can be in front of Randy and we can stand up. I can assess Randy's stability, how do you feel, anything like that. Then I can bring the walker over. The other way is to put the walker in front of the patient like this. Stand on to the side. I'm going to take this out of the way. And then I'm on his weak side, right? Because if a patient's going to fall, they're probably, not always, but they're probably going to fall towards this side. Plus, if he fell that way, the mat's there to catch it. So I can stand over here and help him. For you guys, it's probably best to do it this way, especially as new grads, new students. Get out in the clinic. Randy's a big fella. So I actually would probably, even if I was in the clinic and met Randy for the first time, I would probably ask somebody to stand by for me. Because truth be told, if Randy were suddenly to lose his balance, I couldn't stop him as well as two people do it. So always know your limitations. All right, so let me show you this way first. Okay, Randy, we're going to stand up. You're going to push up really hard with this leg. You're going to take both your hands and push from back here on the wheelchair. Okay, in just a second now. I'm holding him down because I can see Randy wants to stand, but I'm not ready for him to stand, so I'm giving him some tactile cues. Don't stand. I've got a wide base of support. I'm bent low, okay? So on 3, Randy, you're going to lean forward. You're going to stand up, and then you're going to bring this leg underneath you. You're going to put your hands on the walker. You ready? All right, on 3. 1, 2, 3. Good. Bring your leg underneath you. Now, I think I blocked you, didn't I? I blocked you with my foot here. When he went to bring his foot back, I had my foot there, and it kept him from bringing it out. And that's a good point. Now, look how loose the belt is, by the way. once we stood up, because when we sit, our fat expands, right? So once I get up like this, if we're going to walk, I'm going to tighten this belt real quick. So it needs to be tight, right? Oh, transfers are always a work in progress. There's no such thing as a perfect transfer. They're